Okay. Hi, I'm Claire. I'll be your student nurse today.
Okay.
Why are you here today?
I'm just in for physical assessment.
Oh,
Health
okay.
assessment.
Okay. Can I look at your wristband?
Sure.
Can you please tell me your name?
Yes, my name's Claire Scott.
Okay, and your age?
I'm 20.
Okay, your date of birth?
11/3/2000.
Okay. Awesome, thank you. And you're a Caucasian female. Also, could you please tell me your height and weight, please?
Yes, I'm 5'4"
Okay.
and weigh 115 pounds.
Okay, so your BMI is about 20. So
Great.
you're in the healthy range. Apparent state of health, you look very healthy. Any complaints or anything?
No, none today.
Just here for the physical assessment?
Yes.
Okay. And then your grooming and hygiene looks very appropriate. Alright, so your general demeanor, can you please tell me what you ate for breakfast this morning?
Yes, I had coffee and a granola bar.
Okay. And where were you born?
I was born in Raleigh, North Carolina.
Oh, okay, perfect. You have a very logical thought pattern and your speech is nice and clear. Alright. So I'm going to take some of your vitals. So first I'll do your temperature. So here's this. Going to hold it in your ear. Okay. Okay. It reads 98, so perfect. Alright, so I'm gonna read my watch. I'll do it this one. Alright, so your pulse was 60, so that's good. And then your respirations were about 12. So that is within range. Very good. Any pain or anything?
No pain.
Alright, and now I'm going to take your blood pressure.
Okay.
Okay. And I'll stick this on your cuff here. Alright, I'm gonna feel your sorry.
That's okay.
Make sure it's nice and tight. Okay, and I'm gonna feel your pulse.
Okay.
Put my stethoscope on. your blood pressure was 118/70, so that's very good. Alright, and that is all. Thank you.
Thank you.
So I'm just gonna assess your lungs and thorax.
Okay.
I'm gonna inspect over here. Alright. Your skin is good color. Temperature was warm. And then I'm going to pinch like around your clavicle just to see, make sure turgor is very good. Texture good. I didn't notice any lesions. Inappropriate moisture. Okay, and now I'm going to assess your thorax.
Okay.
All right. I'm going to, can you take a deep breath? Oh, I shouldn't mute. Can you take a deep breath in, please? Okay, everything was nice and symmetrical.
Okay.
And the size is appropriate also. Good symmetry. I'm going to feel your clavicles. Yep, everything's in line. Symmetry. Could you also shrug your shoulders? Okay, good shrugs. No retractions. I'm going to feel along your sternum to make sure it's all in line. Okay. Yes. Everything is even. Okay. Excursion. Okay, and then on your lateral lungs, I noticed appropriate color, no lesions. Posterior, I'm going to assess you on the back. Alright, if you don't mind. Inspect. Okay. The color and everything is appropriate. No lesions. And then the scapula and spine. Let me make sure they're nice and even. So, and I'm sorry, would you mind if you crossed your chest?
Sure.
Thank you. And could you take a deep breath, please? Okay, good. Nice and symmetrical. And then scapula's on spine. I'm going to feel along your spine, make sure it's all in line. Good. And then the thoracic diameter, I just want to make sure it's good. So good anterior and posterior diameter. You're healthy there. Alright, and now for this last part, I'm just going to auscultate. And just normal breathing, but deep inspiration, please.
Okay.
Okay, everything was nice and normal there. And I'm going to do it also on your back side.
Okay.
Could you cross your chest, please?
Sure.
Alright, so that all sounded very good. Your rate is consistent with your vitals, rhythm regular, nice and deep. Effort was non-labored, no use of accessories, And no adventitious breath sounds. I noticed vesicular on your anterior side and your posterior side, so that's good. And no lesions, the structure and everything was normal and good symmetry. All right, thank you very much. All right, so I'm just going to do a cardiac assessment on you. If you don't mind, could you please lay down with your head on the pillow?
Sure.
Thank you.
You're welcome.
All right, and inspecting, I don't see any heaves or lifts, none of that in the intercostals or in the epigastrics. It's good. Now I'm just going to palpate across.
No.
Okay, now I'm just going to palpate. Alright, so sternal angle right there. No pulsations, no thrills. Alright. No pulsations, no thrills. No pulsations, no thrills. No pulsations, no thrills. No pulsations, no thrills. And then this last point, I don't feel any pulsation. Actually, I feel a slight tapping noise, but then there's no thrills there. Alright. Now I'm just gonna auscultate. And on this first one, if you don't mind taking a deep breath and holding it.
Okay.
Okay, so. Okay. Everything sounded good there, and I'm just going to go around again.
Okay.
Okay, I didn't notice any extra high sounds, so you're good there. Now I'm just going to check with my belt.
Okay.
Alright, and I didn't notice any extra low sounds either. There is an appropriate relationship between the S1 and the S2 sounds. The rate was appropriate, rhythm regular, strength was deep, no extra heart sounds. And yeah, you're good.
Thank you.
Now I'm just going to percuss across your precordium to make sure everything sounds right. So I noticed resonance, which is good here, and then in the middle area was dullness, and then resonance again. And that's all how it's supposed to be. Thank you. You're good.
Thank you.